long 22 months for all of us. We've been worried, we've been scared, angry, sad, and a lot more, sometimes all at once. It has been a roller coaster, and we're not built for this kind of uncertainty for this long. It has been hard on everyone, to include our children and their families. These 22 months sometimes have brought out the worst in people. It's been heartbreaking to watch people lash out and hurt each other. That is very painful to see. But more often, these times have also brought out the best in people. I've watched people helping and caring for one another in big ways and small ways, especially our nurses, our doctors, our frontline workers. It reminds me why I chose medicine as a career, and it has been heartwarming to see. On behalf of a very grateful Virginia, to all of you, I say thank you. Now, it is painful to see COVID cases numbers rising. Once again, this started around Thanksgiving, and cases are now very high, higher than they have ever been, in fact. I'd like you all to pay attention to this first slide. I want everyone to understand that today's situation is very different from a year ago. Case numbers are high, yes, and that's a reason for concern, but not a reason for panic. And let's talk about why. For these 22 months, we've all focused on the number of cases. It has been one of the defining data points that we've used. But now we need to look at cases numbers differently. That's because of the vaccines. A year ago, vaccines had just become available. Almost no one had gotten a shot. Today, more than 14 million shots have been given in Virginia. Close to 90% of the adult population has had at least one dose. Only 9 states have given more shots, and they are all larger states than Virginia. That's good news, and it's thanks to a lot of hard-working Virginians. And this is important. Vaccinations are keeping people safer, even as the Omicron variant spreads. Yes, vaccinated people can get COVID. That has always been true, and it seems more true for the Omicron variant. But data from around the world for nearly a year now shows that if someone is vaccinated and they get COVID, the symptoms are likely to be minor. Fewer vaccinated people have to be hospitalized with COVID, and far fewer of them die of COVID. That is how vaccines are designed to work. And that is why we need to shift our thinking and study not only the number of cases, but also how severe those cases are. Not just the number of people who get COVID, but also the number of people who are hospitalized because of it. Fortunately, the Omicron variant appears to cause symptoms that are less serious than previous variants, especially for people who are vaccinated. And the data are clear. Nearly everyone going to the hospital with COVID is unvaccinated. Here's an example from Southwest Virginia. 91% of their COVID cases are unvaccinated, including 97% of those on a ventilator. We'll repeat that. 97% of individuals that end up in the ICU on a ventilator are unvaccinated. Vaccines work, plain and simple. That's why we have been saying for a year now, to protect yourself, to stay out of the hospital, please get vaccinated. We also have to acknowledge that while the Omicron variant seems to cause less serious symptoms, especially in the unvaccinated, it's also highly contagious. That means that even though the symptoms are less severe, if more people get sick, more people are going to need to go to the hospital. And that is what we're now seeing around the country, and especially right here in Virginia. It's causing a real strain on the people who work in hospitals. Doctors and nurses have worked tirelessly for 22 months to care for people who have gotten sick. I say tirelessly, but it's not really the right word because they are tired, they're exhausted, and they're burned out. That's why it's so important for all of us to help them. So please go to the hospital only if you believe you really need to. Let's not put even more pressure on hospital workers to care for people who don't need to be there when they're seeing rising numbers of people who do need to be there. That's why we're taking action today to help our hospitals. So why now? Because last week, the daily census numbers in hospitals around the state hit record highs. That breaks a record set 1 year ago in January of 2021, when vaccinations were just starting. And you can see the hospitalizations going up. This chart shows the peaks from December of 2020 through Delta to now. I watch the numbers every day, and I'm in close contact with our health systems. They need our help. So today, I am declaring a state of emergency in order to ease the pressure on Virginia's hospitals and their staff. This order will help in several ways, primarily by allowing hospitals to expand bed capacity and giving more flexibility in staffing. It also allows more use of telehealth, and it expands which medical professionals can give vaccines. This isn't restrictive in any way. Instead, it relaxes some regulations to help get to help get care to the people more quickly. As I noted a moment ago, even though the Omicron variant symptoms are typically less severe, with more people getting the virus, more people need to go to the hospital. Hospitals are feeling the strain. In Northern Virginia last week, Inova said that they admitted 94 patients with COVID. That's up nearly 10 times. Last year, between April and Christmas Day, their average was fewer than 10 per day. In Hampton Roads, Centera said they saw a 300% increase in COVID cases in just 10 days. I want everyone to know that we don't expect this to continue indefinitely. In fact, modeling from UVA's Biocomplexity Institute suggests that we'll see this wave of hospitalizations peak in early February. That is why this emergency order will last for 30 days. I know you're all asking, what can I do? For now, we all need to keep doing the same things we have talked about over these past 2 years. Wear a mask around others, especially if you don't know if they're vaccinated. Get a booster shot. Shots are widely available at pharmacies, at doctors' offices, and local health departments across Virginia. Now's the time to get your children aged 5 and up vaccinated. This will make it easier and safer for them to be in school. If you continue to choose not to get a shot, you need to wear a mask and practice social distancing to protect yourself and to protect those around you. Now, before we turn to questions, let's talk about testing, because I know a lot of people have wanted to get tested in the past few weeks, either because they think they were exposed or they want to be safe before visiting or traveling around the holidays. Last week, we were averaging 50,000 tests done each day, and that likely doesn't count people taking at-home tests. In large part, people have wanted rapid tests, and those have been in short supply due to national demand outpacing our national supply. However, PCR tests are not in short supply, and more rapid test kits are becoming available every day. To help keep up with the demand, last week I announced that VDH would open 9 new testing sites adjacent to their community vaccination sites. These will be able to process about 500 tests a day, 6 days a week, although 3 larger sites should eventually be able to do 1,000 tests a day. The federal government is also in the process of making more than 500 million free at-home tests available this month. At the moment, however, supplies are limited, so everyone needs to use good judgment when seeking those. The actions we've talked about today will help our hospitals and their staff get through this current surge in COVID cases. But there will be another. This virus has shown that it can mutate efficiently. But humans have shown that we can fight back. The COVID vaccines are incredibly effective at preventing serious illness. They have saved millions of lives. And so today, we have lots of reasons to be hopeful. And the major reason is that thanks to vaccines and perhaps the virus's own mutations, this is not the same pandemic that we faced back in March of 2020. We're going to have to live with this disease. We still need precautions to keep ourselves and others, especially small children and especially immunocompromised people, safe. But we will also need to go to school and shop in businesses and feel safe to gather together. That's why everyone who can needs to be vaccinated. Now, I'm going to turn it over to our Virginia Department of Health Commissioner, Dr. Norm Oliver. Dr. Oliver has been here for, I believe, every one of these briefings. Throughout these 22 months, Dr. Oliver has been an important voice in our discussions about the government's COVID response. I want to take this opportunity to thank him, as well as Dr. Lillian Peek, Laurie Furlano, Karen Remley, who helped with our testing, and the whole Virginia Department of Health team for their countless hours of work and worry. This has not been easy, but Dr. Oliver is a good man, and he has done a great job. I also want to thank our Secretary of Health, Dr. Vanessa Walker-Harris. She has been on this team from the beginning. She is an outstanding public health professional and has played an important role in Virginia's work that is among the best in the country. And finally, I want to thank Dr. Danny Avula, our vaccine liaison. Almost exactly a year ago, I appointed Dr. Avula to lead Virginia's vaccination effort. He has done just a tremendous job, and I am so grateful. Dr. Avula is also the head of the Richmond Henrico Health District, and he began transitioning back into that role full-time several months ago while continuing to help with the vaccine effort. I am proud of this team and everyone who has worked so hard on our COVID response for 22 months. We have consistently followed the science, and our approach has saved thousands of lives. We have among the nation's lowest case and death rates per capita, and we are in the top 10 most vaccinated states in the country. Now we'll hear from Dr. Oliver, and then following Dr. Oliver, I'd like our lead counsel, Cindy Bailey, to come up and just talk a little bit about the plans that we're taking moving forward to help with our hospital beds and also capacity and also our staffing. So, Dr. Oliver, well.
Thank you, Governor. I want to take this opportunity, first of all, to tell you how much I appreciate those kind words that you said about me and about the leadership of the Virginia Department of Health. I think right now one of the most important and appropriate things to do is to offer thanks. And I'd like to offer my thanks to the some 6,000 individuals who are working either as staff and salaried employees of VDH or contract staff with VDH. The work that we have done over these 22 months in fighting COVID-19 has been done by those individuals. I've been proud to serve as a leader of the agency, but the actual day-to-day work is being done on the front line, and these outstanding and excellent individuals are the reason why we have saved thousands upon thousands of lives here in the Commonwealth of Virginia. I can't even express enough gratitude for their efforts, and just want to make that statement here today. And Governor, I'll leave it up to you to go for it.
Thank you, Dr. Howard. Cindy.
Good afternoon. My name is Cynthia Bailey. I'm counsel to the governor, and I just have a few comments about the order in terms of legal authority and what the order actually does, and I'll be brief. The order is limited in its time and scope. As the governor said, it's a 30-day order, hopefully to align itself with the peak we're now facing. The governor has power to do this type of order under the emergency provisions of the Virginia Code, which I think you've probably experienced before. In this situation, the order, as you read through it, you'll see that it relaxes or alters or modifies the regulations and statutes that govern the programs of 4 state agencies: Medical Assistance Services, which is Medicaid, the Health Department, the Department of Health Professions, which regulates doctors, nurses, pharmacists, et cetera, and to a smaller degree, the Department of Behavioral Health and Developmental Services. The goal is to provide some relief to the hospitals by providing more beds, which the hospitals say they need, and in particular, the hospitals need more help with their staffing throughout the system. So it expands who can do work in Virginia, who has an out-of-state license, and because some of the, as I said before, because some of these laws and regulations are modified by the order, that's the reason for the declaration of a state of emergency, and we've tried to make it as narrow and targeted and short in time as possible.
Thank you, Cindy. Appreciate it. Hold on just a second. Did you want to take some questions, or you?
I just want to say, get ready to take questions. I'd like everyone to just limit it to one. We have a lot of interest on the press conference, so just please ask one question. Go ahead.
No, as I mentioned at the beginning of my remarks, this is our final COVID briefing because this is our last week in the governor's office. On Saturday, Governor-elect Youngkin will be sworn in, and my team and I will leave. I just want to tell you all, you here in the press, the staff in the room, and everyone watching, how grateful I am to all of you. Every day I have felt so proud and grateful for you, Virginia. I've seen your strength, I've seen your resilience, your kindness, and your generosity. It is you more than anything else that makes Virginia the best state and the best country in the world. Every day, my team and I have worked to make our Commonwealth work better for you and your families, no matter who you are or where you live. At every turn, we've looked for ways to help people. And now we are leaving this Commonwealth better than it was when we came into office. Today, our Commonwealth does a better job of treating people right. It's more welcoming, more open, more fair, and more equitable. Today, we help people who need it, whether they need health care or cleaner water or to keep a roof over their head during a global pandemic. Today, we recognize the wrongs of the past, and we work to reckon with and rectify them. And today, in Virginia, everyone has greater access to opportunity, the opportunity to get what you need to build the life you want to live where you want to live it. We are leaving a strong and healthy Commonwealth, one that treats everyone right, takes care of people when they need it, and provides opportunity for everyone to thrive. 4 years seems long when you're looking ahead, but not when you're looking back. As Pam and I pack up to move back to Norfolk, it seems like we just got to Richmond. I'm incredibly proud of what we've gotten done in that short period of time. We have accomplished the things that I set out to accomplish, steering this state in a prudent manner, investing wisely for our long-term needs, and creating more opportunities for our communities and our people to thrive. I thank you, Virginia, for the opportunity to serve. Elena?
Governor, thanks for having us today. Could you talk to us about your actions today and your talk with the governor a lot? And does it seem to be on board with what you're doing? What have the discussions been like?
Yeah, no, Henry, the actions today are really in response to following the data, looking at the numbers every day, corresponding with our hospital administrations. And as we said, Friday was really I would hope it was the peak, but it was the highest number of hospitalizations that we've had. And so in correspondence with a lot of different people, we chose this weekend to put this executive order, the state of emergency together, and here we are today. I've had several very productive conversations with Governor-elect Youngkin. He realizes that, and he has communicated also with the hospitals, and really our goal, Henry, and I think for all of Virginians to know, is that we want this process to be consistent. We want to, as best we can, be on the same sheet of music so that when we turn over the keys on Saturday, Virginians will continue to get good access to testing, access to vaccines, and also access to hospitalizations as needed. So we've had conversations, as have our staff. And the other thing I would point out, and certainly not to compare, but perhaps we should compare to what happened in Washington a year ago. This transition has been much more efficient. There's been a lot better communication, and that's the way it should be. That's what makes democracy strong. And Governor-elect Youngkin and his staff, they know from conversations that I've had, I want his administration to be successful, because when they're successful, Virginia will be successful.
Bill Atkinson, the Petersburg Press Index.
Yes, thank you very much. Governor, a question following up on what you were talking about, the testing sites around Virginia. Do you foresee any chance that they will eventually be expanded to cover some areas and bring some testing sites in some places such as Petersburg and the Crater Health District, where the virus has traditionally been a higher numbers and the access to the vaccine has not been as great?
If I heard your question correctly, you were asking if there will be more access to testing and also to vaccines, and it sounded in rural areas of Virginia, and I think particularly you mentioned the south side. We have worked very hard and will continue to with testing. As I said, Bill, earlier in our comments, the rapid test, which we call the antigen test, they are in short supply, and so we're making more of them available. And also President Biden will be adding 500 million rapid tests so that people will have these available at home. As far as the PCR testing, which is a more accurate test, we have plenty of supply, but because people have been sick, because the staff has been down, we haven't had the numbers of testing that we would like. But we're opening up more testing centers around Virginia, especially in rural Virginia. And as we've always said, especially with vaccines, we are taking the vaccines to the people. We have mobile units doing everything that we can to make sure that everybody has access. And while the testing is important, while masking is important, while distancing, washing our hands is important, I will take this opportunity to reiterate the only way that we're going to get this pandemic behind us in the rearview mirror is for everybody to roll up their sleeve and get a shot. I know a lot of Virginians, and I commend you all. Close to 90% of our adults have had at least one shot. 70+% have been completely vaccinated, but that leaves some that haven't been, especially in rural areas. And I look at the numbers every day, I'm sure just as you all do. The people that are in our hospitals, in our ICUs, on ventilators, the deaths that are occurring, a lot of them are in rural Virginia, and they are all almost avoidable. So get out there and get your shot.
Why is it taking so long to get these testing centers up? Is there anything that the state can do to speed it up, or are you facing a hurdle that you just can't do it?
Well, the testing sites are going up, and as I've said, we have the supplies, Mel. It's the staffing, and so part of this executive order is to allow people to give more vaccines, or people that are not doctors and nurses, PAs, for example, to give vaccines. And the reality, I believe, when there's so many people sick, whether it be the individuals or their family members, and they can't show up to staff these testing and vaccine centers, there lies a lot of the problem. So the answer, Mel, not to be redundant, at the end of the day, obviously we want as many people to have access to testing as possible, and we want as many people to have access to vaccinations as possible. But the way to remedy all of this is for people to get vaccinated.
Patrick Larson, VPM.
Hey, Governor. Just given the strains that we're seeing on school systems around the Commonwealth, including in Virginia Beach and Richmond, where, in Virginia Beach, we're even seeing some schools going back to virtual learning. I'm just wondering what your stance is on a return to virtual learning statewide, if that's something you all have considered or not.
So I think the question, are we returning to virtual learning? And what I would say, the answer to that is no. We know that our students learn best in the classroom. That's where they're safest. We know that the law, the Code of Virginia, says that we are to follow the CDC guidelines, which is what we've been doing. So that means children in our schools will wear masks. We want our children to be in school, but we also want them to be there safely and responsibly. And I would take this opportunity to say that we have a vaccine available that's safe and reliable for 5 and above. And to date, we've had around 30% of our families that have chosen to vaccinate those that are over 5 years of age. But I would really encourage you all to take this opportunity to get your children vaccinated. Again, they may still get COVID, but if they do get COVID and they've been vaccinated, their outcome will be much improved. And again, as a pediatrician and returning to my practice on Monday, we are seeing very high numbers of children with COVID-19, and the best way to keep them out of the hospital is to get them vaccinated.
So back in mid-August, it was the National Health Association representing emergency physicians called for you to take a number of the steps that you're taking today. So why wait until the hospital census numbers are so high at this point where it's a new record to go ahead and declare the state of emergency?
Well, Jackie, there are a lot of variables, a lot of factors that go into the decision, and it also go into the staffing and bed capacity issues that we're having. Again, I have been following the data and the science from day one of this. I've been in communication with our hospitals. Our ERs are being inundated as well. And so, I've looked at the numbers. Again, we had a peak on Friday, and we worked over the weekend putting this emergency order, state of emergency and executive order together, and that's the decision that we made.
Why not do it before that, though?
I made the decision on Friday.
Inside Northam.
Hello, Governor. We'd just like to know if there's one thing you could have done differently during the pandemic response, what would that have been?
The question is, what would we have done differently? I think we can also always look back and say what we did well, what we could do better. But I would just take this opportunity to say that I am so proud of these individuals behind me. I'm proud of the doctors, the nurses, the volunteer medical corps, everybody that has stepped up and worked day in and day out to keep Virginians safe and healthy. This virus, our first case, was on March the 7th of 2020. There was so much unknown at that time. Governors and healthcare systems were literally competing for PPE. We were ordering supplies from other countries. We didn't know if we were going to get it. We didn't know what we were going to get. We made it through that, and then the testing issues. I remember, Mel, your questions of why can't we get to 10,000 tests a day? Now we're testing 50,000 Virginians every day. We've worked very hard to make that more accessible. And then really the blessing to all of this is 3 safe and effective vaccines that will allow us to put this pandemic behind us if everybody gets a shot. So there have been a lot of unknowns. We have had to, look every day at the science, the data, make adjustments, make decisions. And at the end of the day, I'm proud of our team. As I said earlier, we're in the top 10 in this country with our vaccination program, and I think because of all these individuals that have collectively and collaboratively worked together, we've saved thousands of lives in Virginia, and on behalf of a very grateful Virginia, we should all say thank you.
Governor, just switching things up to last week with what happened on 95. I know you had made some comments that you were tired of people asking about what went wrong and kind of walk that back a little. And can you talk about why you did that and so what's being done to take a look at what happened so that something like that potentially be avoided?
Yes, well, you know, we had a severe storm last week. I think everybody knows about that, Cam, on 95. It started with rain. We were unable to pre-treat our roads because of the rain. It then turned into a slushy snow of up to close to 10 to 12 inches, especially in the Fredericksburg area. That then after midnight turned into a block of ice, literally. And so a lot of people were stuck and stranded on our highways. I regret that. I am fortunate, and I think we all are fortunate, that nobody lost their lives. There were no injuries, as best I can tell, on 95. And I commend, Cam, the members of the state police, the VDOT individuals, the emergency management individuals that were working diligently through the night, helping these motorists, making sure that they had blankets, making sure that they had water. Some of them needed medicine. Are there things that we can learn from this? Absolutely. And after any incident like this, we do an after study and look at what we did well, what we could do better, and they're in the process of doing that now, and I think we'll be able to offer that not only to the Department of Transportation, the state police, the emergency management, but to the people of Virginia to make sure that we don't get into that situation again.
ABC 13 News.
Hey, Governor, you just said to remedy this pandemic, folks need to get vaccinated. And as cases are surging, we still have a lot of folks unvaccinated, especially in our corner of the Commonwealth near Lynchburg. With those final days left in office, is there anything you and your team will try to do, any final push to try and change the minds of those who don't want to get vaccinated?
Well, it's a great question. I think the question is, what can we do to encourage more people to get vaccinated? And you know, I think a lot of people have made up their minds. Certainly as a doctor, I'll be back in my practice on Monday. If there are individuals that have questions, families that have questions, I'll be glad to walk them through that. And I would encourage all of the other providers and nurses, PAs, nurse practitioners, all of those folks to communicate. I think it's also important that we continue to have community leaders, people of faith that reach out to their congregations and just, again, encourage everybody and meet them, if you will, where they are, answer their questions, answer their concerns, and encourage them to get vaccinated. That's the way we'll put this pandemic behind us.
Governor, does this order address whether infected but asymptomatic healthcare workers can return to work without isolating? If not, what's the state's current guidance on that, and are hospitals asking for it?
No, it doesn't change any of that. And we're following the CDC guidelines and in that regard. This.
We've seen some states move to allow that.
Yeah, no, this targets our bed capacities and our staffing challenges.
All right, Andre, last question.
Governor, how are you doing today?
I'm well, thank you for asking, and you?
I'm doing well.
Good.
On the last one, do I get 2 questions?
We were going to give you 5, but if you only want 2.
Governor, you mentioned your talks with Governor-elect Duncan. Just wondering, how is he handling the work that you've done as far as diversity and equity? Is he giving any indication that he will continue that work and keep that department in place?
Yeah, no, you know, Andre, you know, I'm proud of where we are in Virginia. As I said earlier, I believe Virginia is better now than it was 4 years ago, and especially in the area of inclusivity and embracing diversity and being a welcoming state. That's the right way to treat people. It's also good for business, by the way. Businesses, when they look at expanding in Virginia and coming to Virginia, they appreciate the fact that that Virginia is open. In general, Andre, I would say that I think that the governor-elect and his administration have a wonderful opportunity ahead of them. We are turning over an economy, a record surplus, a Commonwealth that's in as good a shape as it's ever been. So they have an opportunity to continue that progress. And I also think they have a responsibility, because a lot of what we've listened to and learned and been able to accomplish through action has been the result of what Virginians have asked for. So I think anybody that's in elected office will have that responsibility to continue to listen and continue to serve our fellow Virginians. You had another question.
Yeah, just on a lighter note, will you miss your faithful press corps, Governor?
I will. And I'll be watching you all and cheering you on. And I have said this before, but there is nothing more important than facts. There's nothing more important than getting accurate and up-to-date information to our fellow Virginians. And so again, on behalf of our administration and on behalf of a grateful Virginia, thanks for all that the press corps does. I wish all of you the best, and stay safe, stay healthy, and if you haven't been vaccinated and are boosted, take the opportunity to do so. Thank you all so much.